Okay, the next item for consideration is House File 635. House File 635, as a reminder, members, we heard this last month and it was laid over. I'm bringing it back here and we're going to amend it to talk about, this is the school-linked mental health grants dollars, and it was a blank appropriation. And now we're looking at an amendment that Representative Bierman is bringing forward to fund mental health initiatives in our schools for this year. So I'm going to move to have House File 635 be in front of our committee, and it will also be laid over for possible inclusion after the amendment. I see we have Representative Bierman here. Would you like me to move the A1 amendment before we talk about the bill, Representative Bierman?
Please.
Okay, I'll move the A1 amendment be adopted. This is a voice vote, and then we'll go to the amendment, which is adding to the appropriations in House File 635. All those in favor of the A1 amendment, please say aye.
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 Any opposed? Okay, the motion prevails and the amendment is adopted. Two-year bill or amendment as amended, Representative Bierman.
Thank you, Madam Chair. Thank you, members. Thanks for taking up the bill again and considering this amendment. I just wanted to review just what the bill was. It wasn't too long ago that you heard it, and I think most members are very familiar with the program. So as you recall, school-linked mental health funding was first established in 2007 with funding going out the door in 2008. And the grant money goes to community mental health providers who then co-locate in the schools. Grant funds are used to provide treatment to children who are uninsured and underinsured, and to work with school support personnel and teachers to build the capacity of the school to address the mental health needs of all students. So the provider bills private and public insurance, and the mental health records are kept separate from the educational records. The provider can also provide care when school is not in session. So it's important to note, members, that this program builds on the work that the school support personnel perform in the schools. And it's critical that we have both. Barriers, including transportation needs, busy schedules, open therapy times during non-school hours, can prevent children from receiving adequate treatment. And school-linked mental health services help eliminate these barriers to school-aged children receiving mental health supports through licensed providers. This bill has a blank appropriation to the Department of Human Services to fund the program through 2022 and adds it to the base. And it sets aside 25% of the appropriation to go to schools that contain the highest number of students with special needs, who are categorized as having emotional and behavioral disorders, or schools with high poverty rates. Commissioner is directed to distribute the grants to rural and urban counties. So the amendment adds an additional appropriation of $6 million to what was appropriated for the fiscal year 2021 school year to support children and makes staff eligible to access services. Adding this appropriation to this bill will expand these grants to serve approximately 8,100 students in more than 1,100 Minnesota school sites. Members, the mental health of our students was a growing challenge before the worldwide pandemic, as you know. As we plan next steps, this bill and amendment will address the continuing needs that we must meet. Madam Chair, I do not have any testifiers, but the Legislative Director of Community Supports from DHS is present, Ms. Kristy Graume, to assist with any questions that members may have, please.
Thank you, Representative Bierman. And just the amendment adds $6 million for these school-linked mental health to start this year, and part of that money would go to teachers and staff. To questions, Representative Robbins. Oh, you're muted, Representative Robbins.
Sorry. Thank you, Madam Chair, and thank you, Representative Bierman. I've heard a lot of great things about this program since I became elected from my school. So, you know, I'm very much inclined to support this, but I don't fully understand it. So I had a couple questions. First, are parents notified when children are participating in getting services through school-linked mental health? And if so, right away or at the end of the school year, how does that work? And secondly, if we're allowing staff to access this, is that temporary or is that going to be forever? And how are staff prioritized versus students who need help? Thank you.
Thank you, Representative Robbins. I think Representative Bierman, I'll direct that to Ms. Graume from DHS.
Thank you, Madam Chair.
Ms. Graume, please introduce yourself to the committee.
Madam Chair, members, my name is Kristy Graume, and I'm the Legislative Director for Community Supports at the Department of Human Services. It's my understanding that parents need to consent to mental health services provided in the school in the same manner that they would consent to services in the community. And in terms of how I think the second part of your question, Representative, was how much money was allocated toward teachers and staff, and then how much was for students. So there's $5 million of the appropriation is for students, and then an additional $1 million is for teachers and staff, and this is one-time funding. I believe it expires July 2022.
Thank you, Ms. Graume. Representative Robbins.
Thank you. Just one quick follow-up. So are we going to be using federal money for this since it's one-time money? And I'm assuming that there's federal money available for schools that could be used for this, or is this state money?
Ms. Graume or Mr. Berg.
Madam Chair, Representative Robbins, the bill as it stands appropriates general fund dollars, as did the governor for this request in his budget.
Thank you.
Any follow-up, Representative Robbins? No. Okay. Representative Kiel.
Thank you, Madam Chair. This is a program that I was actually on a school board when we started doing this in our local schools, and I like the fact that we could kind of work with parents to help our students be successful, because the one constant that goes through school between kindergarten and senior high is a parent, and so I think it's really important that we work with families to help a child who's really struggling mental health wise, and it's a team. The family is a team, with the school being an assistant, and I think it's really important that so I support this program. I think it's helpful, but I wonder, with all that I hear about mental health problems and children struggling, we've still got children not in school who are at low risk. And I really think that that would be helpful to identify children that have mental health problems to begin with, by having them in school, helping them to normalize their life as best that it can be. And I just really see this as an emotional, mental health problem, that we do not have children in school. And I kind of wonder, it's only an expansion for the one school year. Are we going to be hearing about this again? Are we going to need to fund more in the future because of the troubles that we had? And I guess you answered my other question. So anyway, let's go with that. Why are we doing just FY 2022?
Ms. Graume or Mr. Representative Bierman?
Yes, thank you, Madam Chair. So this program has just been re-upped every biennium since 2008. So it's going to be continually funded as we go, as I understand it. I don't think we're going to go longer term, but you're absolutely right. The need for it is great and certainly increasing. And you made a good point about, the fact that, parents are involved, and this is a family. Speaking with my school counselors and school administrators, I think that's the sense that they're trying to imbue in their student body and in their buildings, is that students and teachers and counselors are a family, and that's really what they're trying to cultivate. And the needs of the kids extend beyond what they're trying to teach them in the school. They identify these kids, they know their needs, they know some of their backgrounds, and it's a learning process for the teachers who are certainly tied to those students in ways that are, very close relationships and a lot of concern. And their mental health and well-being is one big part of that. So it is something that I think we will continue to need to address here at the legislature as legislators who see the need and talk to our local schools officials and understand what they need to help make this program better for them. This one school linked part of it is really only a small part of what they're dealing with on mental health issues in the school building. And they say, that what they really want is, in some cases, more counselors in the building to deal with the needs of those kids on a daily basis. And the school linked is great. They'll take the help, but it's not the solution, of course. And it's just another piece of what we can try to do. So hope that answered part of your question, but any more, please.
Thank you, Representative Bierman. Representative Kiel.
Thank you, Chair Schultz. I appreciate that. I think I was misunderstood. When I consider family, I consider mom and dad and child. Now, I understand that some children are going to need to be removed, or there's going to be some other solutions just because there are some serious concerns out there. But what I want to impress is, as a mother, watching grandchildren, being on the school board, the one constant is mom and dad and family. And while teachers are wonderful and have a real important part in children's lives and are influential, and they're important to helping a child develop, mom and dad are the constant. And so if they don't finish high school, if they don't, if something else happens, there's still that family. So I really want to see us work as teachers, counselors, not have so many counselors, but have parents be part of that discussion about whether it is your mental health, or maybe you have I have nephews that are autistic, and parents have had trouble figuring out the guidance. Some parents do really well at it, some do not. But I really think our goal needs to work with parents rather than apart from. And I know there's friction, and it is scary sometimes as a teacher to have your parent come in. My husband's 6'3", and he came in to question a classroom one time, the teacher at a parent-teacher conference, and she was probably 5 foot, 100 pounds, dripping wet. And I could see the fear in her eyes immediately when he asked a question. He was kind of serious. So I know he's intimidating. But after a little bit of conversation, we figured out we were all on the same page. And that's what I think is more important. And teachers, I know, would tell you that it is really important that we work together to help that child be successful and seek a career. So while I think that this is a great program and helping families, especially with mental health issues that we don't understand, I think it just really helps the parents to help that child be successful. So I hope that's my concern, is that I'm supportive of it, but I'm a little concerned that we would cut out parents and that team for that child. So,
Madam Chair.
Representative Bierman.
Yeah, thank you, Representative Kiel. And I hope with what I said that I certainly didn't mean to impinge on any of that strong and necessary and obvious first bond of parent and child. Thank you, Madam Chair.
Thank you, Representative Bierman. I would just like to add that I think we need to be very inclusive when we talk about a definition of family and family members and the support structure that our young learners need. And I also will say that this is part of a much larger package that Governor Walz and the Minnesota Department of Education are supporting to start summer initiatives. So I believe the ask is $150 million, and it would support summer programs, field trips, this mental health piece, and funding for graduating seniors for college courses. So this is a bigger package that's going to be moving through different committees, and we're hearing this mental health piece. Representative Albright.
Thank you, Madam Chair. Good morning, Representative Bierman. In the amendment, I have a couple questions about that, and I see Ms. Bailey is on the line from DHS, but on line 1.7 of your amendment, which we've adopted now, it says increase access to federal grants. And I'm wondering if we could be a little more specific in terms of, is that a 50-50 match? Is it a 90-10? What is the nature of the accessibility to additional federal grant money that you speak of on that line?
Representative Bierman.
Thank you, Madam Chair, and thank you, Representative Albright. We should turn to DHS for that answer on a percentage. I would be guessing just to say what I think it is, but I guess I would rather hear from the department on that.
Ms. Graume.
Madam Chair, Representative Albright, thank you for the question. I'm not certain what the answer is to that, and so I'll have to go back and get that information and provide it to you in the committee following this hearing.
Representative Albright.
Thank you, Madam Chair. Representative Bierman, going back to your amendment on line 1.8, I've read your bill and I certainly understand the context, but in the line 1.8, you say provide additional outside one-on-one mental health supports to students. The word outside can certainly be defined in terms of outside the confines of the building of a school. It could also be defined as a third-party entity contracted to provide those support services. So just wondering if you could define what outside means.
Madam Chair, thank you. Representative Albright, yes. To me, outside means that the professional mental health services are from outside the school. And so this would be referring to the professional outside services that are brought into the school to co-locate to do provide the mental health services.
Representative Albright.
Thank you, Madam Chair. Representative Bierman, as a former minor in English, I would certainly urge you to maybe refine that word to mean exactly what you just suggested. I certainly support that, but I think for others that might be reading that, legislative intent sometimes has to go back to the record, but if we don't have to do that and we can put it into the body of the legislation, I think it's always much a better attitude to take. Going further, Madam Chair, if you indulge me, on line 1.13, Representative Bierman, I note that you're setting aside $1 million to provide mental health supports to teachers and other school staff. And I certainly recognize that COVID and other circumstances relevant to the school day and the past school year have certainly affected teachers and their staff as well. But I'm wondering, since this is focused on children, why it is included or bifurcated out of the overall grant when wouldn't it also be more appropriate to consider this as part of the collective bargaining agreement that those teachers have in providing supports for them, as opposed to this, which is supporting to the students, which is that name students is well seasoned throughout the amendment as well as the bill, but then you include teachers and staff in the body of your amendment. So I'm just curious what the intent there is, if it's for schools or is it for students?
Representative Bierman.
Thank you, Madam Chair. Thank you, Representative Albright. The bill itself and the amendment is for schools. And this is the first time that I'm aware of that teachers or staff, so this includes staff beyond the teachers in the building, people in the building would have access to this. And I think that in the whole scheme of things of the education profession right now, I think that allowing teachers to access some mental health counseling would be strengthening our buildings and our teams in the schools. Teachers, as you know, experience high turnover, they experience burnout, they experience things in schools that, you know, if they have that access and they don't have to make their own appointments outside the building and take time off from work and go there to get the services, and you know, their insurance may cover the cost of this anyway, so it would be billed directly to their provider. I think that would, this is I think an important part of the bill, and I think it's something that hasn't been done before to my knowledge. Perhaps Ms. Graume could correct me if I'm incorrect on that, but I think having been on ed policy the last term and having been out to the schools and mixed with administrative and counselors and having a teacher, my daughter in her first year of teaching here in Minnesota, I think the mental health and well-being of our teaching staff is very important, and I'm glad that it's included in the bill. And thank you for the question.
Representative Albright.
Thank you, Madam Chair. Just one final point, and I understand that this bill is being laid over. My observations just from what Representative Bierman said is, I'm sure education policy is probably, you know, kind of one of the largest focal points of any budgetary session. But yet this bill is not being heard before either of those committees, and we've debated that point on other bills. I don't see that it's been heard by them. You can certainly comment on that if you wish. But my final question for either Representative Bierman or for Ms. Graume is, in the origination of the bill on line 1.12, starting on 1.10, it talks about the highest percentage of special education students categorized as having an emotional and behavioral disorder, and that the grants will be distributed to rural and urban counties. And I apologize if I'm going over gold ground, but how is that assessment or that threshold observed? Where is the beginning of that threshold for high poverty, and how do we do that? Is that a pro rata by population, or is it based upon the EBD score for every school district? Could you just elaborate on what that means as you're appropriating this grant money and asking for the governor's budget request?
Representative Bierman.
Thank you, Madam Chair. Thank you, Representative Albright, for the question. I think we'll request some help on where the lines are if they have those. I think taking the state and calculating, you know, how many students in a given year are in those programs is obviously the point of departure, but what that looks like from a broader perspective and results, I'm not exactly certain. Perhaps Ms. Graume could assist us in that area.
Ms. Graume.
Madam Chair, Representative, I believe we work with the Department of Education to get that data and assess it. And I do have one of our policy experts, Ms. Singh, with us that might be able to better respond to that question for the committee.
I'm sorry, could you repeat that name, Ms. Graume? Ms. Singh?
Ms. Singh.
Ms. Singh, please introduce yourself to the committee.
Madam Chair, members, my name is Vijay Singh, and I am the Clinical Behavioral Health Director for Community Supports Administration for DHS. And as Ms. Graume said, we are working in coordination with MDE to look for specifics on the data to identify and make sure that our children and families who are desperately in need of these services get it. Besides the fact that we know that kids and families who are on Medicaid really meet that income eligibility criteria of poverty guidelines. We in fact got a position funded through federal grant. It is a 0.5 data position that is working in close collaboration with MDE to develop a statewide waiting list so we can get a better idea and some numbers to make sure that we are reaching to the kids who are really in need of services. Thank you.
Thank you, Ms. Singh. And I'll just add that, you know, the path of this bill, pieces that were taken so we could just hear that section of the larger bill, and Chair Davney is leading the effort in education finance, and we'll be hearing the final legislation, and it'll be in front of various committees, Representative Albright, and will be vetted extensively. Representative Sandell.
Thank you, Madam Chair, and Representative Bierman. First, I want to say, as a longtime teacher and coach in elementary and secondary schools, that in-school health clinics providing support for mental health and well-being of families is terrific, and an enormous support for the teaching and for the emotional growth and stability of the children as well. Representative Kiel, I think that the most successful of those programs and most effective of those programs have always involved the caregivers and the families who support and love the children who want to see them succeed. And I certainly agree with you. And Representative Albright, I worked at the university for a while, and the university provided a mental health counseling for their faculty and staff, and it was I'm not sure, Chair Schultz, if it's available at UMD as well as it was at the Twin Cities campus, but it was a support for many people, and personally, it was a tough time for me, and I used those services, and I was grateful for them. Representative Bierman, I've been working with an organization called the Minnesota Alliance of School-Based Clinics, and I'm sponsoring a bill, House File 2176, that would seem to have a lot in common with your work, and I wonder if we could talk offline, maybe with Chair Schultz as well, about that. Thanks very much, committee, for the chance to mention those concerns. Thanks, Chair Schultz.
Thank you, Representative Sandell. Okay, Representative Bierman, any closing comments?
Just a thank you to Ms. Graume and Ms. Singh for being here to help out on the bill, and thank you again to members for listening and adding some really good input or questions and more things to think about as this bill moves forward. Appreciate your time. Thank you.
Thank you, Representative Bierman, for bringing this bill and the amendment. So with that, members, House File 635 as amended will be laid over for possible inclusion.